What happens when you get an epidural? Epidurals can be wonderful. They can take pain away, but what else goes with an epidural? I have a nice tool here to demonstrate. So this is a list of options, and they're all turned over right now to be in the uninterrupted birth category. So if you choose an epidural, and I know people have good reasons for doing so, it is totally a choice, and all interventions do have their place. If you were planning a home birth, say, with a midwife, then you've given up your choice of birthplace. Possibly when you have an epidural, you get transferred to a different care provider, depending where you are. I know lots of people don't have options about these things anyway. Your labor could start on its own still. Maybe you've had early labor at home. When you have an epidural, you also get an IV and continuous monitoring just to make sure the baby and the maternal patient are all healthy. You will not be wearing your own clothing anymore, probably, unless you have, well, it depends where you are, but many places would insist that you put on a hospital gown. Obviously, you have pain meds running and an epidural. Now, most people who have an epidural will be confined to bed for the safety of the laboring person, because falls in the birth unit are pretty high when people walk around with epidurals. So you might be confined, probably will be confined to bed. Doesn't mean you have to lay on your back, but you likely won't be getting up, probably won't be using the bath and shower. Definitely you won't anymore, just because of all the hardware that goes with the epidural. You also will be told, with very few exceptions, you'll be told not to eat anymore. And being confined to bed, you would have a catheter instead of getting up to use the toilet. So these are the things that definitely go with epidural. Now, the things that often go with epidural as well, sometimes with epidural, it can change how our body responds to the labor hormones, and oxytocin or pitocin might be used. So in that way, now labor is being picked up with medication. So meds to speed up labor. Your choice of birth position might be limited by your mobility, or it might not, depending on how the epidural works and also on your care providers. A lot of people who have epidurals don't feel the same urge to push. Some do, some don't. So this card may or may not be turned. Epidurals do increase the rate of vacuum or forceps and episiotomy and perineum stitches or repair after. So these things may or may not be part of the experience. So like I said, epidurals do have their place. I like people to know what else goes with any interventions they choose. I'm making a whole series of those. If you subscribe to my channel, you'll see more of those. I'm Angie the doula. I teach prenatal classes and train doulas, and I have all kinds of information on my website, my social media, everything's in the link below. Thanks for watching.